Hello all. Today we'll be discussing some neurology questions. A 30-year-old patient presents with a gradually increasing headache, which she describes as being dull, aching at the top of her head. Despite having no previous history, she describes having suffered uncontrollable jerking movements yesterday, subsiding only 30 seconds. She says that the worst part of headache is the fact that it reaches a crescendo in the morning, making it difficult for her to get to work on time. What is the likely time? So let's look for some clues in the question, right? So what are the things that you see in the question? There is a gradually increasing headache, right? So it's not sudden onset or something. It's gradual. It's gradual, and it's a 30-year-old female. And there is one seizure-like episode for that patient yesterday, where they had a seizure-like episode, right? Tonic-clonic seizure-like episode. So there is seizure along with the headache, and there is early morning headache. Early morning headache. So these are the three clues that we have. Okay, early morning headache. From this keywords, we'll try to figure out what the question is asking about. So now these are our options: brain tumor, cluster headache, epidural hemorrhage, migraine headache, subdural hemorrhage, and tension headache. We'll try to see what fits to this kind of headache that the patient has. So we'll first see the three types of headache that we have. That is cluster headache, migraine headache, and tension headache. How they are different from each other. In cluster headache, what is the usual history? It's a young male patient where there is severe headache, and it is associated with conjunctival congestion, and it can last for maybe some time, maybe 1 day, 2 days, and then it subsides, and then it restarts again months later. It's not a chronic or continuing and gradually increasing headache. So this picture of this young female doesn't fit into cluster headache, right? We are ruling out the options. Okay, how about migraine headache? Migraine headache is usually unilateral. Again, there can be photophobia, phonophobia. It can be associated with some aura. There can be nausea, vomiting, and there can be some aggravating features like sunlight, for example, dehydration, caffeine. All this can trigger migraine headaches in the patient. Again, it can last for some time. It can settle down, and then um, happen again sometimes later, maybe multiple times in a single month. And it can be aggravated during even menstruation. But again, it's not a gradually increasing headache. There is no early morning symptoms, especially, and there are no seizures associated. So it's not migraine headache, right? Now, migraine, severe migraine, there can be some stroke-like events and all, but that is another category. Simply migraine headache doesn't fit into this picture. How about tension headache? Tension headache is like a band-like headache. Okay, it's like a constriction band, and it can be, mild, moderate to severe, and it can settle after some time, maybe with painkillers and all, with NSAIDs, it can settle. Again, it's not a gradually increasing type of headache. So we have ruled out all those three kinds of headache that we know. How about brain tumor? Brain tumor is an intracranial space occupying lesion. There can be raised intracranial tension, and that can lead to early morning headache. Okay, again, with brain tumor, you can have seizure like episodes, and it can be gradually increasing as the size of the tumor increases. The headache can worsen in severity. So brain tumor can fit to the picture. We'll see the other options before we commit to that answer, right? Epidural hemorrhage, subdural hemorrhage. So these are intracranial hemorrhages. Epidural hemorrhage or extradural hemorrhage is usually due to trauma and over the temporal region. Okay, in RTA we can see middle meningeal artery. It's getting ruptured, and that is leading to headache and bleeding. That is extradural hemorrhage. There is a classic lucid interval wherein the patient gains some consciousness in between two unconscious intervals, right? That is epidural hemorrhage, usually in a setting of trauma, again not fitting in the history. How about subdural hemorrhage? Subdural hemorrhage again in alcoholics or elderly with recurrent falls. They can have a chronic subdural hemorrhage, which can again be a chronic headache, but there is no history of fall in this young female patient. Okay, so altogether, this uh, history is fitting towards brain tumor. So, what is the answer? It's brain tumor. So, that's how you rule out and that's how you fit in an answer. Okay, so the keywords here are gradual, association with seizure, and early morning headache due to increased intracranial tension. So that's all for this question. We'll come with another question.